A high-end brain scan MRI in Tokyo runs roughly $320. In New York hospitals, that same scan on the same machine runs roughly $3,800, a 1,000% markup. On the surface, many believe that Japan's healthcare system is simply better than the United States. They live longer and care is simply cheaper. But that's only part of the story. Today, we're comparing the United States and Japan, what has shaped their systems, what they both have gotten right and wrong, and why the US might actually be better positioned for what's coming next. Let's dive in. So let's get into it, the good and the bad for both systems. But first, I need to give you a little bit of needed context. In large part because of World War II, the US got locked into a system where your health is tied to your job. Japan, on the other hand, took the path of social solidarity instead, creating a mandatory national insurance program. Fast forward to today, the United States healthcare system is known for being complex and expensive. Japan's is known for being relatively straightforward and inexpensive for patients. So how does Japan's healthcare system work, and why do some people believe it's headed toward disaster? Well, unlike the United States, where most people pay for private insurance to cover them for emergencies or doctor's visits, Japan offers universal health coverage to all of its citizens and anyone who stays in Japan for 3 months or more. Even to you if you decided to stay in Japan for 3 months or more. In Japan, private health insurance mostly just fills in the gaps of the public system. And to be honest, there really aren't that many gaps. In Japan, the government sets what's covered and then what everything costs. The Ministry of Health, Labor, and Welfare updates a national price list every 2 years, and every hospital and every clinic has to follow it. Essentially, prices stay pretty much the same no matter where you go. If you have a really nice job or if you have a terrible job, you're getting basically the same coverage. And contrast that to the United States, where you could go to the same hospital in Riverside, California, and you can get the same knee replacement for just under $16K, or maybe your hospital bill total ends up being over $101K, depending on your specific insurance. Then you're forced to pay your portion based off what that final total is. And that's not to say that in Japan, patients don't pay a portion of the bill like they do in the US. The difference is it's more predictable based off your income and your age, between 10 and 30%. But that sounds kind of high, right? I mean, if you had to pay 30% of the total hospital bill in the United States, you're probably gonna owe thousands of dollars. Well, to offset that burden in Japan, they have caps. Basically a maximum amount of money that a Japanese healthcare patient would have to pay. If you're just a standard Japanese wage earner, the most that you're gonna pay at a hospital or for prescriptions would be $529, plus 1% coinsurance on expenses exceeding $1,764. For lower income patients, they have caps of only $380 US. Higher earners, you're probably never paying more than $2,000 in Japan for healthcare, certainly not if you don't have a lot of money. In contrast that to the United States, where January 1 to January 1 the next year, you could end up paying over $10,000 on medical bills, even if you pay monthly for your insurance. Here's an example of how that might look. But it's not all terrible for the United States. Because of how our system is set up, you typically don't have to wait a really long time to see a doctor or a specialist. People often complain if they have to even wait a month. Nationalized healthcare systems, though, are often criticized for their excessive waits. Well, once again, Japan has found a solution for this issue, and their waits are some of the lowest in the world. Sometimes you can see a doctor day of. They did this by getting rid of gatekeepers, having their doctors see as many patients as possible day to day, and having an extremely high number of hospital beds available to their patients. When it comes to social support for those with lower incomes, Japan also does well there. Through public assistance, people in serious financial hardship pay nothing for care. And you might think I'm going to talk about how terrible the US is in comparison to Japan when it comes to low-income patients, but that's actually not the case. One thing that many don't know in the US is that we have fairly strong charity care programs, where if you make up to 200 to 250% of the poverty line, you're often eligible to have your hospital bills be waived entirely at many nonprofit and even for-profit hospitals. This definitively doesn't help those middle-class wage earners, but it does help those with lower incomes. But by and large, a strength of Japan's system is that it ensures that lower income individuals don't go bankrupt for medical expenses. But that strength is actually exactly what's putting the system under pressure. Okay, so from a patient perspective, Japan's healthcare system sounds amazing. You have low waits, you can see a doctor day of, you can go as much as you want, and nobody's really going into medical debt. So how could the US possibly be in a better position moving forward? I mean, everything I've just said is kind of the opposite in the US. Well, both the United States and Japan have a looming problem. And this problem will more seriously exacerbate Japan's healthcare system rather than the United States based off how they're structurally set up. Japan's population is aging faster than almost any country on earth. This means there's going to be more retirees and less workers to replace them than ever. Remember, their healthcare system has fixed prices, often lowest for those aging populations. That is a really bad combination. By 2040, Japan is projected to be short 11 million workers. This is bad because they fund the system, but maybe even worse than that, there's not going to be enough workers to physically deliver care for their huge aging population. Throw in the fact that their employer-based health insurance societies are projecting major deficits, 70% of them, and medical and nursing care centers have reached their highest level of bankruptcy since 1988. They're effectively being squeezed by the government's pricing system, you can only make so much, and increasing labor costs. You gotta pay doctors, especially if you expect them to see so many patients like they do in Japan. In the United States, it's the opposite. The system is inconsistent and expensive, but it's also very flexible. Prices can adjust, which they often do, which is a bad thing for patients because it's usually in the direction nobody wants, but it is a good thing for the sustainability of the industry. And this is why so many US companies have begun to explore alternatives to traditional health insurance with these big health insurance companies. Many do something called self-funding, where they basically become their own internal insurance company to lower costs for themselves and for their employees. You can subscribe if you want to learn more about that. But going back to Japan, their government is aware of their difficult situation. They've begun shifting toward wealth-based premiums, not just income, and pushing people to stay in the workforce longer by redefining what elderly even means. And that's why, even though the US system looks worse today for the average patient, you can make a serious argument that, good or bad, it's better positioned to survive what's coming next. If you'd like to see more content like this in the future, please consider subscribing for more. This is Tyler Dutchover. Thanks for watching.